afternoon, and thank you for joining us today. I am Maria Aurora Diaz, Regional Director for Community Health at AMITA Health Northwest Region. It gives us great pleasure to welcome you today to the third annual Health Counts, Kane Health Counts Building Community Resilience Virtual Symposium. Before we get started, we just want to go over a few housekeeping friendly reminders. Please remain on mute during the presentation. There will be a question and answer session at the end of the presentation. You can submit your questions in the chat box and the panelists will respond to them. Your participation in the poll is greatly appreciated. At this time, I would like to thank our Kane Health Counts Collaborative Executive Committee for hosting this symposium. In 2011, Kane County Health Department started a collaborative community health assessment and community health improvement plan process. This process aimed to identify health priorities in the community and strategies to address them. Since then, Kane County Health Department has joined forces with 5 local hospitals, which include AMITA Health Mercy Medical Center in Aurora, AMITA Health St. Joseph Hospital in Elgin, Northwestern Medicine Delnor Hospital, Rush Copley Medical Center in Aurora, and Advocate of Aurora Sherman. Along with the Inc. Board, a mental health 708 board serving the southern part of Kane County, and a number of community partners. This group comes together with the mutual interest in improving the health of Kane County residents. In 2014, this collaborative group was given the name Kane Health Counts. This comprehensive community health assessment process is conducted every 3 years to identify the top health needs and priorities in Kane County. This collaborative works together to plan, implement, and evaluate strategies that are in alignment with the identified health priorities. Together, this group proudly strives to make Kane County the healthiest county in Illinois. At this time, I would like to introduce Stacey Zhang, who is our Community Health Planner for Kane County Health Department.
Hi, everyone. Thanks for spending your lunch hour with us. My name is Stacey Zhang, and I'm the Community Health Planner here at Kane County Health Department. I did launch a poll, and I'll leave that open for a few more slides to give everyone a chance to answer those questions that we're just curious to know who is in our audience. So this first slide shows the 4 assessments that were conducted in the fall of 2020. The community health assessments that we use different methodologies for data collection in all of these. And the goal is just to be sure that we're collecting data in different ways and also from all areas of our county, north, south, east, west, including residents, key stakeholders, really all walks of the community so that we collect a broad range of data. The first assessment, the forces of change, identifies how issues going on around us, such as the political environment or the economics, how these factors impact our health. The local public health system assessment measures how well our public health system is delivering the 10 essential public health services. It's important to note that that our public health system is not just made up of our local health department and our hospitals. There are all entities that impact the health of the public. So we're looking at our schools, our municipalities, park districts, churches, not just the traditional healthcare centers. The Community Health Needs Assessment is our community survey. This was done online, and we placed a link on our website. We shared it on social media. Many of our partners helped with promoting this link as well. Maybe even some of you participating today took the survey, we hope. And this survey provides us with the quantitative data specific to the health of our residents here in Kane County. And finally, the Community Themes and Strengths Assessment. We held focus groups to hear more specifically from our underserved communities. We wanted to make sure we were reaching those folks that we may not capture in that online survey. And so we held sessions for Spanish speaking, African American, and older adult populations. So after we conducted these assessments, we had a prioritization event. And during this event, we presented the data. We had around 80 Kane County residents and key stakeholders from across the county attend the presentation, and they ranked the health needs based on that data. And these were the results. You can see that mental health and mental health disorders is continuing to rank very high in our county as a health concern. So the full report can be found on our website, which is at the bottom of each slide. It's kanehealthcounts.org. So that is our data website. Please visit that website for any more information. And again, you can read the full report there. So all this leads to our focused ranking results, are our 4 priority areas that we identified here in Kane County. 2 of these areas were already established based on past priorities, those being behavioral health and nutrition, exercise, and weight, which was previously referred to as chronic disease, but just taking a more preventative approach to this new team. And 2 of these areas are actually new, those being access to health services and immunizations and infectious disease. So our action teams are now going to talk about their work and what they're doing to assist in the development of our next community health improvement plan. So I am going to go ahead, and it looks like the poll's been closed, and I am going to hand it over to Uche Anwuta to present about our NEW action team.
Hello, welcome to our symposium. My name is Uche Anwuta, and I'm the Director of Health Protection at Kane County Health Department. So 6 out of 10 adults in the US have a chronic disease, and chronic diseases are the highest leading causes of death in Kane County. Most of the ones that you usually hear is heart disease, cancer, stroke, chronic lung disease, diabetes. These are the leading causes of death in Kane County. So when we looked at, when we looked at the priorities in Kane County, we came up with many chronic diseases, as you can see in the red, highlighted in red. These chronic diseases are what the nutrition, exercise, and weight are the risk factors of these chronic diseases. These major risk factors of most chronic diseases make up the reason why nutrition, exercise, and weight becomes one of the top priorities that we're considering. On our chart, 5 out of the 18 areas that were assessed have nutrition, exercise, and weight as their major risk factor. And also, these 3 risk factors are 3 of the 5 CDC's leading modifiable risk factors for chronic disease. The other 2 are tobacco and alcohol consumption. Next slide. So the major areas of concerns in this area are obesity, access to healthy foods, and physical activity. 32% of adults in Kane County are obese, and about 37% of children 5 to 17 years old are obese. 28% of our adults report no leisure activity, and 19% report eating at least 5 servings of fruits and vegetables. We have issues with access to SNAP certified stores, 1.5 per thousand in Kane County, which is lower than Illinois and the US. And as many of you know, in this pandemic, hunger has been a huge public health problem. So next slide. So the NEW action team has been hard at work meeting several times already, brainstorming strategies and objectives for the NEW action team. We took the time to brainstorm what is currently available in the county and how equitably accessible these resources are. So the Jamboard, what you see here is the Jamboard that we created from those exercises. We also used a strategic issue worksheet to do a thorough inventory of what is currently available and what resources we have in the community. Next slide. So we came up with some cross-cutting areas that apply to all three areas of physical activity, nutrition, and weight. And these are education and awareness, access to services, and concentrating on adults and children. Next slide. So the first goal we've come up with is to increase awareness and utilization of community resources for nutrition, exercise, and weight management in Kane County. Next slide. So we also came up with some objectives that will address this goal area. By December 2024, to create a directory of free and low-cost nutrition, exercise, and weight management resources in Kane County, to create a referral system for the three areas integrated in IRIS, which is our referral system that's already in use here in Kane County, and to establish annual health promotional events for nutrition, exercise, and weight management in the northern and southern parts of Kane County, and explore having a health promotional event in the Tri-Cities area. And to also establish a marketing campaign. It's good enough to have these resources, but we do have to get the word out for what they are and where they are and how to access them. Next slide. So for our next steps, we'll finalize our goals, formulate some objectives and strategies, and determine baseline measures for our objectives, and then submit the implementation plan, and the implementation begins next year. Next slide. So these are the organizations we have currently as an action team, members of our action team, and we really hope to expand to add more organizations to it, so that we're very representative of the vast resources we have in Kane County. This is my last slide. Next slide. So I'll hand it off to Laura Barrett, who will speak to you about the access to health services priority. Thank you.
Thank you, Uche. I'm Laura Barrett, the Director of Disease Prevention at the Kane County Health Department, and I will review over the access to health services. As we go through this, our team currently has representation from all of our hospital systems here in the county, along with Aunt Martha's and Greater Elgin, Greater Family Health, and VNA Healthcare. So all of our FQHCs are here. And we also included some other areas. We've got the United Way, Gail Borden, and PACE, Oak Street Health, and Tri-City Partnership. So we've got a pretty broad range group, but we are always looking to add more if anyone is interested in participating in this as we go through the information. So next slide. So our timeline, we started with our first meeting on July 30th, and we met about every other week during the month of August, and then we met in September for once. We had our meetings from 11 a.m. to 12 noon. We have upcoming meetings this month in October, the 14th and the 28th, and we'll continue to work on finalizing our goals and work on those objectives and action steps to be taken as a team, and those will be coming on up over the next couple of weeks. The next slide. So far, what we've done some brainstorming with various strategic issues. Uche kind of showed that Jamboard that was on up. We used those. We identified some common themes off of that. Then we went into an impact and effort grid to identify off of those common themes, areas that we are going to be working on. And then we started developing some potential goals. Our core areas of concern that we identified for access to health services. And when you think about access to health services, it was one of the top areas that was identified in the community health assessment. And it also incorporates all those areas. So if you have a chronic disease, you're going to need access to healthcare. If you have mental health illness, substance abuse, you need access to healthcare. If you need immunizations or infectious disease, access to healthcare is going to be, touching all of our other groups that are working with it. So we will work together and collaboratively with those as we work forward. We kind of identified 5 areas, though, that were of real concern when we looked at access to health services here in Kane County. Specialty care was one of those areas that came on up. So not only those areas I just identified, such as mental health, but also dental, and also looking to outpatient testing, such as an MRI or ultrasounds, those type of things. So when we talk about health services, it's not health care as in the traditional ways that you maybe think of going to see a medical provider, but it's also these other areas that we want to expand into and look at. We also identified public awareness and education, such as coverage for their insurance. Do they understand what a PPO versus an HMO versus Medicaid coverage versus Medicare coverage versus Medicare Advantage, TRICARE? What are those options for health services when you are uninsured or you're underinsured? And what are those options that might be available for us? So those were areas that came on up. We talk about health equity. We know we have certain pockets and certain zip codes in our county that are very underutilized with access to health services, and there's multiple challenges, and to help look at that health equity and try to see how we can develop a plan that will reach out to all of our county residents wherever they're at. And our county is quite unique. We have the 2nd and the 6th largest cities in the county and the state in our county, both Aurora and Elgin. But we also have a very rural western edge of the county too. So the diversity of our county makes a lot of challenges available for us. And transportation is one that came up in there, whether it be public transportation or utilizing our many park districts and senior services and things for those rural areas to help with that transportation to get into appointments. So transportation was definitely an area that we wanted to look at. And then of course, affordability of care and coverage. So those are again talking about all those different plans and what does a deductible mean and how does that get into a contracted rate with your medical billing, and just some basic information on how that coverage and care is actually available. So we came up with 2 goals. The first one was to improve an understanding of healthcare coverage and navigation of our resources. And that will cover some of those other areas and incorporate in the educational component there that we could use. And then the next goal that we came in, started in the drafting stage, is an improved transportation to healthcare providers and services for disparately impacted communities. So areas that are having that impact of transportation to help them get in to see their services. And I think that may be my last one. So thank you. I'm going to hand it off to April Elliott and Teresa Knopf to talk to you about immunization and infectious disease. Thank you.
Hello, everybody. My name is April Elliott, the Assistant Director for Communicable Disease with the King County Health Department, and I'm here to talk to you about our priority group for immunizations and infectious diseases. So this priority group is new to the Community Health Improvement Plan, and I believe with COVID-19 and other infectious diseases on the rise, there has been a cause for interest in this area and a concern related to how immunizations and infectious diseases impact our community here in Kane County. So this action team's overarching goal is, in accordance with Healthy People 2030, is to increase the awareness to prevention and treat infectious diseases here in Kane County. Next slide, please. So in order to have an impact on that particular Healthy People 2030 goal, the Kane County Health Department has reached out to various providers and community stakeholders here within Kane County to be a part of this endeavor. So here you can see the various organizations with that currently represent an aspect of how to approach immunizations and infectious diseases, whether it be education, treatment, or advocacy. And although our action team is comprised of many, our team benefits greatly from any additional support our community provides. So as we continue to move forward, we do look forward to have our team grow, to have action team members who represent various areas within King County. Next slide. So as mentioned in an earlier slide presented by Stacey Zhang, there were various warning indicators identified within immunizations and infectious diseases. So those with the focus ranking were the 5 that you see here: COVID-19 case fatality, HIV cases, chlamydia incidents, syphilis incidents, and pneumonia vaccination. So our action team looks forward to the opportunity to have an impact on all of the warning indicators and more within the upcoming years. Next slide. And I'll hand it over to Teresa Knopf, who is the co-facilitator for our action team.
Good afternoon, everyone. Thank you for attending this meeting. I am Teresa Knopf, and I am the Assistant Director to Disease Prevention at Kane County Health Department. Our group met for immunizations and infectious diseases. We first started our meetings on August 12th, 2021, and we were meeting for about an hour and a half each meeting, going through such things as a Jamboard, looking for common themes, and looking for goals for our group. We met weekly until August 26th, and we're currently meeting every 2 weeks. And just like April said, we would look forward to anybody joining our group and assisting us. Next slide, please. We have been brainstorming various strategic issues. We then identified our strategic priorities and common themes, and we're developing potential goals, strategies, and barriers. So that's where we are right now with our team, looking at how we can whittle this down to things that we can do directly to help our community. Next slide, please. And then we're gonna, in the future, review and finalize the goals, identify objectives, and indicate action steps to meet those objectives. And basically, we're going on to now, I will give it over to Michael Isaacson for behavioral health.
Thank you. Good afternoon, everybody. My name is Michael Isaacson. I'm Assistant Director of Community Health here at the Kane County Health Department. And I'll just talk for a few minutes about the work that we have going on around our behavioral health priority. So we're still in the planning process. Behavioral health has continued to be a high-ranking issue when we do our community health assessments. This most recent community health assessment, mental health was identified as the top priority in our community surveys. And unfortunately, with the pandemic, we're seeing a lot more trauma in the community. So not only people losing loved ones, losing jobs, more domestic violence, increases in youth suicide, increases in overdose. The number of negative outcomes that we're seeing is really staggering, and our families really need support. So we are continuing to work with both the Kane County Behavioral Health Council, which we use as the vehicle to move this work forward, and also many community partners that are working to help families in the community. I do want to acknowledge Bernie May, who I know is on the call, who's the co-chair of this committee, and also Bernie's with Family Service Association of Greater Elgin, and Michael Moran is the other co-chair with Waubonsee Community College. Currently, just our high-level goal is to increase access and appropriate utilization of behavioral health services in Kane County. So that's an overarching goal. Obviously, built within that, we have not only needs for access, we have needs to reach families where they are. We have needs to make sure that we are engaging both the youth and customer voice in everything we're doing. And then also we need to make sure that we're really taking a look at how we can increase capacity because all of our community organizations are under tremendous strain. And we're just currently not able to meet the demands to really serve people with what they need. Next slide, please. I do want to mention one of the specific parts of the assessment that Stacey mentioned earlier, and that's the forces of change assessment. And here we look at different things that are going on in the community that may have an impact on health of our residents moving forward. And just wanted to highlight a couple of things that are occurring that are having a tremendous impact on behavioral health. So certainly, as I mentioned, COVID-19, this pandemic has put tremendous stress on everyone. Looking at K through 12 education, this continues to be an area where not only are families struggling with illness, with quarantine, with over the past year, with people trying to adjust to try to balance their work life with managing the needs of their students so that they could do remote learning. But also right now, we're in a very volatile time in our country where there's a lot of negativity being addressed towards our schools in relation to masks and vaccines. So I really commend the work that everybody in our school system is doing and also appreciate how challenging this has been for our families. Laura mentioned access to healthcare, so I'm glad that that's also identified as a priority so we can work together on that to make sure people are getting their needs met. We take a very holistic approach, and there's not one person who is just getting their behavioral health needs met. We all have physical needs, we have work needs, we have family needs, so we want to look at this in a very holistic way. Unfortunately, we're seeing increases in poverty and also more disparities in health outcomes and how people are treated. So this is certainly going to continue to be part of our work as we move forward. And then the social unrest that we saw last year, I think has really changed the way a lot of people in the country are looking at things. This is perhaps brought to the surface a lot of things that have been part of our country for a long time. And I think has really changed the way both the social unrest as well as the pandemic are changing the way we all look at things, how we look at work, how we look at how we spend our time, and how we look at services we need. That has an impact on our mental health. So we want to make sure that we're incorporating all of that in our plans as well. Next slide, please. So a couple of things that came out from focus groups that were done with community members that I just wanted to quickly highlight. We're seeing increases in anxiety and stress. So parents and families are reporting that kids and our schools as well are feeling extra stressed right now because of all the change and uncertainty and social isolation. So social isolation, as I mentioned, is another topic that comes up a lot, and this has impacted people of all ages, from students on up to our seniors who have been very isolated over the past year and a half. Just the separation from our normal routines is incredibly stressful. So not only everybody being shifted to potentially work remotely or other people being asked to continue to come to work when they were potentially afraid, working in grocery stores and restaurants and things like that, of exposure to COVID. But then this shift back to work, which is an ongoing discussion across this country, where there's massive issues in terms of people figuring out what the new normal is going to look like. That's having a tremendous impact on people's mental health. And then finally, people talked about just accessing services. And as I mentioned, we don't have the resources we need to adequately meet the needs of our residents right now. So that's going to be a big part of what we're doing, is looking not only how we can work smarter, but also we need more resources. So we want to improve the system and increase people's access. Next slide, please. So areas that we've talked about, and we're in the prioritization process with our group still, looking at workforce recruiting and retention. Many of our behavioral health organizations, and we actually just had a public forum 2 nights ago where many of our mental health providers were able to share with the Kane County Board the high numbers of vacancies that they have, the turnover rates that we're experiencing as people leave these really challenging jobs to go other places for higher paying work. So that's something that we want to address. And I think systemically in Kane County, there's work we can do to get more resources to our organizations, and also things we can do to make Kane County, especially the people who are serving as the behavioral health safety net, make that an appealing place for people to work and to stay. We want to look at our crisis response processes. So there's some changes going on at the state that may impact how things move forward. So we want to make sure that all of our organizations continue to be at the table together to make sure that we're providing residents with the most effective things that they need. We want to continue the promotion of our electronic referral system. So this system, IRIS, just started rolling out in March. I want to acknowledge here from the health department team, Kim Peterson from our early childhood network, Sophia Ottamanelli from our opioid work, and also Anna Cerniak, who leads our children's mental health work. They've done an excellent job getting the IRIS system out, and we're getting more and more people using it so we can get people quickly connected with the services that they need. Stigma continues to be an issue for both mental health issues as well as substance use issues. So we're working with different groups in the community to try to reduce that stigma, to make sure that people feel comfortable coming forward and getting the help they need. And the sooner we can get people help, the better. We also have the opportunity with the new 988 lines going live across the country. We want to make sure that for suicide prevention, that this is something that we're really prepared for here in this community, that we can make sure that resources are available so that when people call, not only are they getting quality support at the end of the line, but they're also getting access to resources so that they can get into services that may help them. Funding, I could put over and over in bold letters, we need more money to support our mental health system. So this is definitely going to be something that we continue to work on. One priority that we're going to continue with is integrating primary health care with mental health and substance use treatment. So how can we do a better job back and forth with physical health and mental health and with substance use issues? So we're engaging pediatricians, we're engaging family doctors, and also engaging mental health providers to make sure that they have that connection back to the physical health as well. And then finally, the last thing I wanted to talk about was just increasing resources. So this is not necessarily just limited to money, but how can we bring in better training? How can we bring in better transportation, as Laura mentioned, for the access to care piece, so that we can make sure that people are able to get all of the help they need? So there's a lot going on in the behavioral health realm. I think even though needs are tremendously high, I think there's a lot of positive energy right now. So we thought this was an appropriate quote for all of the work that we have going on. So alone we can do so little, together we can do so much. That's certainly the truth. And if you are interested, based on anything you've heard any of us talking about from these different work groups, please drop your name and email in the chat. If you'd like specific information or you'd like to join one of our groups, we'd love to have you join us. And then I'll turn it over to Stacey. We've got the results of the poll that we should be sharing here.
Yeah, so hopefully everyone's seeing those results from our poll. Always kind of exciting to see that we're talking to our residents and folks out in the county that maybe have never heard that we actually do a process like this, that we do health assessments of the community and write a community health improvement plan. So again, like Michael said, we would be happy to have you join one of our teams. And as always, you can reach out. You can reach out to myself or any of our action team leads. So, and then the second question, just kind of who do we have today? So it looks like we have a lot of folks coming from the community or social service area. Also education and government law enforcement. So again, welcome. Thanks for joining us. I'll take down our poll results and I'm going to hand it over now to our presenter, Jonathan. You can go ahead and start sharing your screen.
And I'll go ahead and introduce him.
Oh, thank you, Delilah.
Our presenter today is Jonathan Shively. Jonathan is the Executive Director of Fox Valley Hands of Hope. Hands of Hope is our region's premier agency, focusing exclusively on compassionate care for those experiencing loss. Prior to joining Hands of Hope in March, Jonathan was a development officer, seminary instructor and administrator, national church executive and pastor. He is the founder of Artistry Leads, a leadership and organizational consulting practice. Jonathan holds a Doctor of Ministry degree from Fuller Theological Seminary and has completed educational programs through Elizabethtown College, Bethany Seminary, North Park University, and College of DuPage. An ordained minister and licensed nursing home administrator, he finds creative expression as a singer-songwriter. Jonathan and his family, including 3 young adult children, are residents of Elgin. He spends his days in search of precious moments which defy the atrophy of the world. His passion is to equip individuals and communities to live their fullest lives. Attending to loss and grief is a cornerstone toward this holistic vision. And so, Jonathan, please take it away.
Thank you so much, Delilah. It's great to be with you here this afternoon. I want to thank Kane County Health for this invitation and for inviting the new kid on the block to speak today. One of those is true. Either new or a kid, you can decide. Really, I'm humbled and I'm grateful to speak with you today. I recognize this as an auspicious gathering, and I'm aware of how much I still have to learn about loss, grief, and our communities. So please receive my remarks as coming from a position of engaged naivete rather than that of an expert, and know that I view today's reflections as my foray into joining these conversations, which have been going on for many years. On June 6, 1952, Charlie Brown first uttered those now famous words, "Good grief, Lucy." In the black and white cartoon that you see in front of you, Lucy asks, "Would you like to have a great big bug, Charlie Brown?" To which Charlie Brown, never quite seeming to get the message, replies, "I guess it would be all right." Exclaiming here, Lucy throws a bug in Charlie Brown's face, causing him to yell out, jump up, and declare, "Good grief, Lucy, I thought you said hug." Good grief has become synonymous with exasperation, being bummed out, depressed, feeling down and dismayed, and basically just about any other negative emotion. Since our hugs have been interrupted over the past 20 months due to COVID-19 and the pandemic, I too find myself exclaiming, "Good grief," on a repeated basis, or sometimes other words carrying the same negative emotion. Good grief is, however, a worthy declarative because it is one of those phrases that holds strong irony. Grief is our response to loss, especially through death, of someone or something that we have formed a bond or affection with? Can the painful truth of that loss, the disruption of grief, actually be good as well? Recently, there has been a COVID-19 memorial on the National Mall in Washington, D.C. With nearly 700,000 flags spread out on the open grass near the Washington Monument. This memorial is an attempt to help an anxious and divided nation grieve, if not heal. We will offer a similar opportunity, represented by lights, here at Fox Valley Hands of Hope, beginning with an evening service of remembrance on October 25th, to honor the 900 Kane County COVID-related deaths and the many others who have died throughout the pandemic. The emphasis of my remarks today are not directly about deaths attributed to COVID-19, but rather about how the last 20 months under pandemic conditions have impacted what we might consider our normal grief practices. And the data we saw earlier already gave us a lot of clues. To say that the dominant culture of the US has normal grief practices is not necessarily to say that we have good grief practices. Of the many discouraging things about our culture that the pandemic has surfaced, the lack of positive perspectives on and practices for facing loss are of primary interest for our conversations today. The pandemic has melted away the veneer of our coping mechanisms and has shown us just how ill-equipped we are for bereavement. Under stress, such as that caused by the pandemic, grief has been piled on, and in many cases left to fester. Since our time this afternoon is limited, I will cut to the chase. First, we'll look at some of the basic features of grief. Second, we will look at some intensifying factors of grief during a pandemic. And third, we will examine some principles for nurturing healthy individuals and building healthy communities in the face of so much grief. Before we go on, though, I do want to give a shout out to our staff clinicians, Eric and Jacqueline. I think Jacqueline's on this meeting. Our clinical intern, Gabby, and super friend of FVHH, Marissa Happ, for providing important elements of this presentation. So how do we recognize grief? Well, first, it's important to remember that everyone grieves differently, and that contrary to some popular interpretations of grief theories like Elizabeth Kubler-Ross's 5 stages of grief, or for today, the aptly named 10 stages of Granger Westbrook's good grief cycle, grief is far from a linear step-like process. Grief is messy and unpredictable and hard. At Fox Valley Hands of Hope, we most often draw on a dual process model developed by Margaret Strobe and Henk Schutt that features a dynamic oscillation between what's referred to as loss-oriented stressors and restoration-oriented stressors. But there are other models as well. Regardless of the model, common signs of grief, and you're probably familiar with most of these, might include shock and numbness, denial, thinking that you're hearing or seeing your loved one, forgetting your loved one is dead and turning to them in conversation, anger, guilt, confusion, an inability to concentrate, mood changes, unexpected crying, feeling hopeless or helpless, sadness, a decrease in self-esteem, lack of decision-making capacity, and bitterness, to name a few. When a person has all the support that they require and has strong support in other parts of their life, even then, loss can be extremely difficult and can impact one's health, financial stability, job performance, social engagement, identity, and relationships. Unfortunately, very few people have all those supports already in place when they experience loss. When we begin to view those experiences of loss within the context and under the circumstances with which they occur, bereavement and living with loss can become quite complicated. So what are some pandemic factors that are complicating our experiences of grief? Well, this was already referred to in a prior part of the report, the increase in anxiety just culturally and in general for folks, feelings of ambivalence and destabilization, feeling unsafe. The pandemic has created a heightened intensity of people's emotional response. Just watch interactions between cashiers and customers, physical separation, statistical dehumanization of death, reporting death as numbers, constant reminders of death, the masks we wear, the signs that greet us on the doors we enter, the requirements that we need to follow. Again, as has already been pointed toward in the earlier presentations, we know that throughout the season of pandemic that we have experienced some additional stressors, including a heightening of the social access gaps. We know that the pandemic has had a disproportionately negative impact on people of color, people in lower economic categories, and children. When we specifically look at grief and loss, we have statistical information that tells us that 17.5% to 20.2% of our children have experienced a loss of a parent above what would normally be expected. And this would be due to COVID. And that as of, this was a February statistic, so I'm sure the number is higher, that 37,300 to 43,000 kids are estimated to have had lost at least one parent due to COVID, again, as of February. The other thing we know is that while 14% of US children are Black, 20% of children who have lost a parent to COVID are Black. So you can just begin to see the disparities that we know are there. During the last year and a half, and we anticipate for years to come, bereavement and healthy response to loss has been and will continue to be complicated by disrupted closing rituals. I'm sure many of you have had the experience of a memorial service, for instance, that was displaced for a year or more. Not being able to be with a loved one as they are dying, an absence at the time of death. Not getting to say goodbye or not getting to say goodbye in person. Unexpected losses that under non-pandemic circumstances we would not have expected and didn't even expect under the pandemic circumstances. We're experiencing a higher number of deaths than we would normally. And of course, isolation plays a big factor in how we deal with grief and loss. Loneliness attached to isolation, disenfranchisement, judgment, politicization, delayed grief, and maladaptive grief, which leads to often aggressive and difficult behavior patterns. Trauma and grief are frequently intertwined, and our clinical staff is finding it more and more difficult to separate the two. And so we're very aware of that interplay of those two experiences and impacts on a person. We also know that grief has imposed itself deep into our individual and collective psyche, and it will continue to impact our lives and the quality of our communities moving forward. We know that unattended grief can have a host of negative consequences, including emotional breakdown, can contribute to mental health crises, can contribute to job struggle and loss, is a leading cause of fractured relationships, can lead to financial hardship, disruption in education, addictive behaviors, and of course, a whole host of other responses that are both personally and corporately damaging. Just a quick word about providers and caregivers, and there are so many of you on this call this afternoon. The struggle is real, and I don't need to tell you that. Empathy fatigue is a real factor when it comes to dealing with grief and loss. Exhaustion, the ability to have the energy to hold deep wells of grief alongside others, the increasing incidence of burnout. One kind of strategy around this, which is talked about by Dr. Gabor Mate, who is focuses on human development, is to speak about the self-compassion imperative, he calls it, that invites us to be kind to ourselves as those who are caregivers and service providers, knowing that we cannot do all that needs to be done, and that too often we cannot do enough. And to deal with that in our own lives requires that we develop a sense of self-compassion, not just extending compassion to others all the time. So finally, what are some positive signs and hopeful practices that we might turn to? I know we're getting to the time here. I'll get through these quickly. We have a chance. The first thing I'd like to say is we have a chance to learn from one another's cultural competencies and develop new competencies together. Our dominant culture, and I'm speaking obviously as a white middle-class male, our dominant culture's approaches to death and dying would do well to learn from other cultural experiences, of which there are many in our own communities. We need to see those. We need to recognize those. We need to learn from each other about those. Secondly, while isolation is certainly an impact of the pandemic, in some instances, we have become more aware of our neighbors. Because we've been forced outdoors, many folks have told us that they're more connected to their neighbors and more aware of the needs and strengths of their block and their local community. So how might we parlay these new awarenesses and relationships into informed and compassionate care for each other? Third, resilience. It's earned a space in our daily conversations, and of course, it's the overarching title for today's session. At our best, throughout the pandemic, we have witnessed and learned the stories of people overcoming great odds. While these stories have been around as long as humankind has been walking on Earth, the pandemic seems to have elevated the stories and heroics of resilient humans. Resilience is indeed a valuable attribute and one to celebrate. I'd like to offer a word of caution, however, that I hear being raised, because when resilience is celebrated in the face of systemic failures and circumstantial irresponsibility, we may be overlooking a need for a deeper root cause, concern, and action. In other words, should one be required to be resilient because the context in which they live demands resilience and imposes its need as the only way forward? The pandemic has also given us an opportunity to further explore our personal and cultural assumptions, preparedness, and responses to grief. Loss is a great common experience. Everyone experiences it in their lives, whether anticipated or tragic, direct or indirect. No one is exempt from living with losses, deaths, and permanent separation. Grief might serve as a common space for us, even when it has a potential to divide. There's also a great deal of talk about returning to normal. Michael, you refer to the new normal. We should not, nor do I think we can, return to the pre-pandemic normal. Rather, we should take this moment as an opportunity to improve our honesty about death, to better equip ourselves to encounter death and loss, and to nurture a deep and abiding compassion for one another as we experience the losses that we will all inevitably encounter. Just about to the end. Furthermore, we should take time. Grieving takes time. Holding space with someone who is grieving takes time. Building those new normals takes time. Many of us have a choice now. We can rush forward with a rebirth post-pandemic soon, freedom of activity perhaps, filling every moment of our days with ambitious and distracting activity, or we can live with some release from those obligations, taking up new opportunities to further understand and engage the experience of loss, grief, death, and dying, and support one another in our resilience and healing. Addressing our own grief, the grief of those around us, and the community's grief also takes courage. It takes courage to seek out assistance to deal with loss. It takes courage to hold space for loss and to hold the loss itself. It takes courage to make meaning with a loss. At FVHH, we've been offering COVID-19 loss support groups, which puzzlingly have been undersubscribed. We think it's because we haven't found a way to help people with their courage. We're planning more, so please let your networks know. Finally, at FEHH, we hold a commitment that no one should have to grieve alone, and that there should be no barriers to receiving compassionate care and support for anyone who is experiencing loss. That's why we never charge our clients for our services. Grief in the midst of pandemic may be particularly overwhelming, complicated, and damaging. Our response need only match with intensity that overwhelming need, beginning with our patient companionship and empathetic care. Perhaps then we can utter good grief as an expression of hopefulness. Perhaps then when we hear, "Would you like a big hug?" that's exactly what the world will provide instead of one more big bug. And I think it's over to Alex.
All right. Thank you, Jonathan. Thank you so much. What an incredibly relevant and informative presentation and powerful, I might add. we're going to open it up to questions at this point. We still have a few minutes, and if you'd like to take yourself off mute, I will answer directly one of the questions. All of these materials, this entire presentation has been recorded, and the presentation and the supportive materials, including this presentation, will be available on the website following this meeting. So with that, are there any questions anybody'd like to ask of Jonathan? Remember to take yourself off mute. No questions? That's
I have
all.
a question.
Yes, go ahead.
Mavis Bates, Kane County Board. How are you funded?
Yes, we're all community funded. So we're funded through private donations, fundraising activities. We're funded through foundations. We're funded through several of the 708 boards, including the Inc. board. Those are our current sources of funding.
Okay, thank you.
Other questions? Lots of great comments, Jonathan. Thank you. I hope you look at paying attention to the chat. Very powerful. Thank you.
Great.
Terrific. All right. Well, we're Stacey, any other comments we want to make, or do we want to go ahead and let everybody go a minute or two early?
Yeah, I just had a quick question. If there was, anything that we could do to, support our coworkers. Most of us are, dealing with our own struggles through work and also personally through, the pandemic. Any just, quick things that we can do to kind of alleviate the stress.
Yeah, I mean, that's a tough question. I think about that every day here with my own staff. And I think, I think compassion is the key word. It's to be aware of what one another is dealing with. Sometimes that takes creating real space and time to have those conversations, to be present with each other in a way that allows us to hear those things from one another. I'd be an advocate for kind of continually checking in. Those of you who have what do I want to say, who are able to influence work schedules and commitments to your organizations, to be mindful that, we have higher stressors now, and it's particularly in our direct care and helping professions, and that, we might need to adjust our policies a little bit, or at least our activities about how we're moving forward. A little extra grace with each other. If there are kind of specific or just discrete kinds of losses or issues that have come into your workplace or have affected your community, we always are glad to take a call from you and talk about how we might come alongside you and support you. You might also refer individuals that you think might be having a particular need related to loss to us. and we'd be glad to try to locate them in one of our programs. But I think the main, this sounds pretty trite, I think, but the main key right now is we just have to remember our humanity with each other. And the work will always be there. Like Gabor Mate says, the impact that we could have if we had unlimited personal energy resources and organizational resources is unlimited. Maybe to keep in mind what is ours to do and how can we do it best together. So those would be a few things. I'm sure there are other more specific things that could be added to that.
That was well said. Jonathan, if you've got a few minutes to stick around, we're at 1 o'clock and we're gonna, anybody who does need to run, please do run. But I know you said you've got a couple minutes. You can stick around afterwards to answer a few questions. And there are, I'm gonna go ahead and share a couple of questions if you don't mind that are in the chat box. But
yeah, I see them.
Yeah, thank you to everybody who was able to attend and participate in the symposium today. Thanks to all of our guest speakers. But we are going to stick around for a couple minutes. And if you see those, Jonathan, if you can see those questions, feel free to answer them yourself.
I can, yeah. I see a couple of questions about are our services available to speak to medical staff and healthcare providers? Absolutely. We would welcome your outreach to us, and we would work with you to determine what the best way to do that would be, whether it's a staff person or we also operate with a great core of volunteers that are well-trained and experienced in grief support. So we would do that. I would also respond to the question, are COVID-19 groups in Spanish? Yes, we make a concerted effort to both provide opportunities in Spanish, and when those opportunities are not specifically in Spanish, to provide translations so that people can participate in those groups. And again, we feel free to reach out to us for further information about that. I think those were the questions I saw. Did you see anything else, Alex?
No, I think that covered it. So Jonathan, thank you so much for your time. Stacey, any closing words?
So I just see the for continuing education credits, will they be sent automatically? I'll ask about that because I know we had collected that information on the back end, and I'll make sure we get that taken care of for anybody who needs continuing education credits. But those are available for this session today.
All right. Well, thank you, everybody. And I guess this goes without saying, but I'm going to say it anyway. Take care of yourselves, too. That's critically important. So thank you, everybody, and have a wonderful afternoon.
Thanks for joining us. Thank you,
right.
everyone.